Well, why don't we go ahead and get started and we'll do it. It is February 19th, 2025, a little after 1:30 in the afternoon. Regular scheduled meeting of the Lewis and Clark County Metro Region Governance Committee of the Montana Opioid Settlement. We'll start with roll call. Mayor Wilmot Collins.
Here. I don't know why you can't see my face. I think the operator there refuses to show my face. So.
All right. Councilman Wes Feist.
Here.
Tom Ralph here, Commissioner. Member Colleen Smith.
Here.
And we're James Petrovich, member. And we're expecting that he may show up here shortly.
He is at the dentist and is hoping to be here as soon as possible.
All right.
He got his appointment is going along.
Okay. All right. That sounds good. Any questions or corrections to the two committee meetings that we had set? Let's take a look at the committee meeting for December 4th, 1st. Any corrections or changes? And then for December 19th, any corrections? There being no apparent corrections, we'll accept them as printed. All those in favor of accepting those minutes as printed, say aye.
Aye.
Aye. Opposed, same sign. Motion passes. I think I heard, did Mayor Collins respond?
I did. Amanda, is there any way you can put up my video?
Mayor Collins, it looks like you should be allowed to do it. So I don't know if
it says you cannot start your video because the host has stopped it.
That is the same with us at Good Sam's.
Okay. I'm not sure I can turn them on, but I'll keep trying.
All right.
Because they're not.
Motion passes then for
They're in his panelist.
4-0. Of course, we'll go to
It's
the
right
roll.
there. I'm sorry.
Oops.
Excuse me. Commissioner, allow participants to start video isn't checked. It's right above your mouse. There you go.
There we go.
Sorry, excuse me.
Commissioner.
Thank you.
Trying to read it at the same time.
Yes.
Thank you.
Slowly. I might try it now, Mayor Collins.
There we go. Oh, there we are. Wonderful. Wonderful. Okay, let's take a look at the correspondence review. Moat updates and information memo, December 5. Is there something that anybody wanted to bring up about that?
Do you want me to just give a quick overview, Chairman Rolfe, what that one was? Just move on.
See anything on that?
So the memo it was in the larger packet. I didn't print it for everyone just because it would have been a 50-page packet. But it was in the agenda. The memo from the 5th just included an update related to what projects statewide have been funded thus far. If there was any notes or questions, I just wanted to make sure we had an opportunity. Everyone had an opportunity to review that. The memo from the framework that was sent on December 10th provided some resources for our committee to consider as you're looking toward funding, just best practices and other resources that are out there available to the different abatement regions. So that is that piece of correspondence. And then The item from January 10th was a memo regarding the appointment of the advisory committee. So this was the Moat State Advisory Committee. I didn't receive any nominations or requests from the committee. We do currently have a local representative, Brenda Neiman with Lewis and Clark Public Health. So it stands to reason that we would feel sufficiently represented, I guess, within that larger group. There was a recommendation to reapprove a member that had already been on the committee, and then they were looking for additional nominations. So if there's nothing more that our committee would like to add, we'll just make sure and let the folks at the staff know that.
I did not pursue anything more because of that exact reason. I felt like we had our representation on that.
I did ask somebody and she was not interested, so.
Okay, good. All right. There was, so everything's clear on those appointments and reappointments. Anything else that anybody wants to bring up? Then we'll move on to item number 4 on the agenda, election of a chair and vice chair. And it'd be my suggestion that we kind of rotate and this because several of us are elected and may or may not be around long term, and I thought we should rotate out, and it would be my recommendation that if it's okay with the rest of the group, that we move Councilman Wes Feist to chair, and then we elected a vice chairman to vice chair to replace that, replace Wes. And like I say, some of us are going to be, normally there would be a change from the county, but I requested to be here second year because it took so long to get us all rolling and everything. So, all right. Does that, do we have, is it, let's have a little discussion on this. Is there any thought about how you want to proceed? Does that seem reasonable to do that?
I think it makes sense.
Yeah.
Okay. All right.
I agree with you. Commissioner Rolfe.
All right.
Before,
go ahead.
Before a motion's made on that, would my request, or I don't know if it would be a motion on its own, to hold off until James is able to join maybe later today, so that just to make sure that he feels the same, and or whoever we choose to then elect as vice president, that all of us are in coordination and a say for that.
I think that's
not to put it off any further, but
no, I think that'd be.
make sure we're all available. Yeah,
I think that's a good suggestion.
Okay.
All right. Why don't we put that decision down a little bit, down the meeting down, and we'll go ahead and work through the other items. Is that agreeable with everybody? Okay, sounds good. How about then let's go move to a status update on the funded projects. And Amanda, or which one of you would like to make the report there?
Go ahead, Amanda. Okay. Thank you, Chair Rolfe. So we did receive correspondence from the Moat staff today, Stephanie McGowan. She said that the Storpy, that was the training project that was recommended from this group, they have an agreement signed and funds have been dispersed. The grant agreement with St. Peter's Health has also been signed. They haven't funded them yet because they're waiting on an address confirmation. She also mentioned, but didn't go into detail, of that they have updated the way that they'll be funding applications. So they'll be following up with St. Pete's to visit with them about that change. But she said that she anticipates they'll receive their funding within the next couple of days. We did provide them, she just goes on to say, thank you for some SMART goals verbiage. We had provided them some feedback from this committee that we were looking for some more measurable metrics from the applications. And so she's going to take a look at that verbiage and see how it might be incorporated into the future applications.
And just handed me a balance that shows that with the items that we have voted to fund, we have a balance of 194,917 left in the first year fund. And then on July 1st, there'll be another $400,000 coming with the new fiscal year. Any questions on that? One of the other things that I had thought too that we ought to talk about, it looks as though the Region 4 group has not really formed yet, which is the 12 county area that we are additionally a part of. And has anybody talked with you folks about what's happening there?
I'm not aware of anything, Commissioner.
Yeah.
With respect to the formation of that regional committee.
Who's in charge of that? Like putting it together?
Those 12 counties.
So there's not like a point person.
Not that I'm not sure, but
Have any of the 12 counties determined who, and it's waiting on 1 or 2?
I don't have any information about that remaining region.
I think that when you look at that map, there's 3 of the counties that have their own area. Butte, Silver Bowl, Gallatin, and Lewis and Clark, like we are set up. But the other 9 counties, this is going to be a primary source of funds for them, and they may want to get it moving. I wonder if it wouldn't be good to have staff to kind of just check around with a couple of counties and see if something is moving on that.
The Region 4 funding comes from their own funding source. But if we wanted to do joint project, then portions of us. But hopefully their main source is not directly from the Lewis and Clark.
No.
Lewis and Clark metro region. We would just be partial to it. Yeah.
And it may be that the smaller groups, the 9 smaller counties, figure there isn't much there. Don't know, and I don't know. But I think we ought to at least be inquiring about it and see if we can't help it out a little bit along if we need to.
It's a lot of population that's been served through it. So especially Region 4 is a lot of communities in a big city.
And a lot of our health activities are take in Mar and Broadwater and Jefferson.
Yes.
And so I think it's worth that, and then possibly Powell.
So they have $640,000 in their first year balance.
Yeah.
What was our first year balance?
600.
600 even.
And Mr. Chair, Commissioner, my understanding as well, we are kind of outlined in yellow there. We are distinctly a separate metro region committee. So yes, while there could be collaboration and the multi-region request that would have to be to both.
Mhm. Okay. Well, if Anne, maybe I'd ask you to do a little checking around and then get back to the committee and see where see what we might do to help them and maybe it's moving ahead and the smaller committees or counties are all already working on it, but I think we ought to make sure it's happening. So, okay. Anything? I guess that we've got the report on the funding, funding review. Let's take I guess our number 7 item on the agenda is a discussion of the new funding requests, and this is the opportunity for discussion with the folks from Good Samaritan about a request that they've put in. Why don't we start? Let's just turn it over. Who all is here from Good Samaritan that would like to tell us? I think I see Teresa and Catherine.
Catherine.
And-
Hi, good morning. And then we have Ryan Gallagher, who's our street outreach coordinator.
I think we've all had a chance to kind of look at the proposal. Why don't you go ahead and go ahead with a presentation and we'll see if there's questions after that.
Sure, my name is Catherine Mans. I asked Ryan to attend today because he is in fact our full-time street outreach provider and so is very familiar with the challenges in the community that we serve. Specifically for the opioid harm reduction grant that we wrote, we're seeking funding to augment his position, particularly with regard to the core strategies identifying expansion of warm handoff programs and recovery services. Ryan has been limited in some of his approach to it wasn't inclusive of opioid reduction and harm strategies. Not to say that individuals don't present with these conflicts and these situations and issues, but we feel that with this funding to augment his position to be a peer support in the community. We do have several peer support in our day program at our place, but Ryan's job and challenges are out in the streets, meeting individuals where they are in plain sight, quite frankly. And so we thought that his position, if it also had the benefit of a part-time or 2 part-time individuals to help with housing navigation and some of the other resource navigation challenges that are presented to individuals that are unhoused currently in our community and struggling with opioid addiction. That would be another element to strengthen our warm handoff, and street outreach. We also wanted to add a prevention program that worked in tandem with Ryan's efforts in street outreach in the community and in the schools and in the other nonprofit arenas and other youth-focused areas where the next generation who may be at severe risk because they might be living in communities with high community disadvantage index and already, in areas where they're at risk because of just the circumstances of their life. And so we thought this would be an additional component in outreach in the community that Ryan and another team member could support. And we've grown out essentially, unfortunately, of just having the one, and he is funded. His primary role adjacent to our place is funded, but the specific harm reduction within the opioid reduction and harm preventive strategies are not something that is currently part of his purview. And so at this time, he's funded under ESG and emergency service grant funding. But we are again looking for funding specifically through this instrument, this funding instrument for the next couple of years so that the street outreach employee can have additional resources. So the application that we submitted is designed to engage people who are at risk of drug overdose where they are, and Ryan, as our street outreach professional, has been able to do warm handoffs in some arenas, and we feel that with the additional funding for him to initiate harm reduction strategies for opioid prevention would be very advantageous in our community. Are there any specific questions? I mean, I could go over our program abstract. I'm sure you guys have looked, but it's essentially enabling us to have the resources and the staffing in the field, in the streets, to increase the prevention activities that do reduce stimulant use disorder and opioid related deaths, and providing peer support and recovery and community navigators and other connections along with our current street outreach program and community-based services will enable additional and more expanded linkages to community supports. And so we also recently initiated criminal justice involved activities, and Ryan has been part of that process, and this would enable us to expand it so that when we did identify individuals that were engaged or part of the criminal justice system and are now about to be released, they would have the supports, the continued supports, targeting and specifically the harm reduction efforts of keeping them off opioids that may or may not have been part of the reason why they were incarcerated to begin with.
One of the things that we have found recently at the work that can be done is it can be expanded to helping people with mental illness issues as well, because the opioid, so many folks that have an addiction and also have a struggle with mental illness.
Correct.
And I think if you can expand that call to include
Yeah. We absolutely, that's a good point, and we absolutely do and are aware that substance abuse, mental health, and co-occurring disorders are all kind of part of a trilogy of issues that do impact community and do lead to the unsheltered experience, incarceration, isolation, and alienation from the community, and supports that they may potentially lean on if there were not various stigma. And Ryan's position, and if the STOPS campaign is initiated and brought forward with this funding instrument, we would be able to absolutely address with our partners in the community that we do work very closely with, that do have the evidence-based resources to ensure that people do find their recovery bases, that they do find the resources and the strategies to reduce or end their own line of opioid use. And certainly for our evidence-based practice that we want to incorporate in the schools and the community, in addition to Ryan, it would bring additional dialogue to youth that might not otherwise be exposed in a good, positive way to the ravages of the drug war, quite frankly. So, the peer support staff that we currently have lived experiences. Ryan comes in as our street outreach person that will work with additional peer support if we're successful with this application that have lived experiences. Ryan is more of a clinical academic at the moment, and so he gives a refreshing third-party perspective, but works with and in sort of coordination with individuals that do understand the challenges of individuals that have been and are currently living with substance abuse, mental health, and co-occurring disorders. So it is, we think, important that our street outreach program and campaign become more aligned with this harm reduction. You know, we are well aware of how so many individuals are first introduced to the opioids that then destroy their lives. So if we can be part of the solution that I believe, you know, the pharmaceutical companies do want at the end of the day in the communities, we are ready to take the messages, the challenges, the resources to individuals that need them, where they need them, because not all of them are going to show up on their own. They will need someone like Ryan and the other peer supports to bring them into treatment and to bring them into safety. We do meet people where they're at. That is part of kind of our slogan or you know, the charge forward. You know, you oftentimes need to find individuals where they are, where they're comfortable, root them out of that negative comfort zone and into a position or amongst the resources that they might not even be aware are available. So we do refer them to other resources in the community, including our day program, and of course, any other resources that the county and the city have for individuals that are seeking recovery. We work very closely with a long list of local providers.
Anybody else from your team want to make a comment or?
Brian, would you like to make a comment?
I would love to. First of all, I just want to thank everyone for the opportunity to be here with you all today. And I think you really hit the nail on the head when you mentioned mental health and substance use disorders being linked. What we do know is that over 90% of people with an opioid use disorder are also using other substances. And many of these individuals are also living with other mental health concerns. And so when someone's using multiple substances, this is called polysubstance abuse. And these individuals have higher rates of overdose, mental health issues, difficulty accessing treatments, and things like that. And the CDC is reporting now that over half of opioid overdose deaths now involve stimulants. And so even the members of our community that are not intending to ingest opioids, it's still getting into a lot of these street drugs. And I really think there's a lot of strong evidence to suggest that street outreach is an effective method for identifying opioid users and connecting them with essential services. Some key findings that I looked into before coming here today. In 2020, the Journal of Substance Abuse Treatment found that outreach teams are significantly more likely to engage opioid users who have never accessed treatment before. And I think that's one of our big goals is trying to identify people who need these resources that are not currently accessing them. And we know that many opioid users, especially those that are experiencing houselessness, do not seek traditional healthcare or social services. And the outreach workers are able to come in and engage these individuals, building trust over time. And it has ultimately been shown that outreach is often the first point of contact for many individuals who later enter into treatment. Uh, and this looks like a lot of different things. Outreach can connect individuals with medication assisted treatment, such as methadone. Peerview is a big provider of that here. SAMHSA has also supported outreach-based engagement programs, which is sort of the model that we're trying to encompass, which shows that street outreach leads to higher retention rates in these treatment programs. Outreach workers such as myself, distribute Narcan, or also known as naloxone. And we train individuals who are using opioids, as well as their peers, how to prevent an overdose by using Narcan. And in 2021, the Drug and Alcohol Dependence Association found that street outreach programs have increased Narcan usage and carriage by 70% among opioid users. And this has significantly decreased overdose mortality rates. So it's vital that we have people in the streets meeting people where they're at, providing education, engaging, building trust, and ultimately connecting them with services. And I guess the last thing I want to touch on is dollars. You know, money's very important. And a report from the National Healthcare for the Homeless Council highlighted that every $1 we spend on outreach saves $5 to $10 in healthcare and criminal justice costs. And that just really stuck with me as I was looking into how can these funds best be used to support the clients that we're looking to support. And it seems that outreach is definitely a great vehicle for delivering these services. Yes, Teresa, I see your hand is up.
I just wanted, when you're finished, I just want to jump in, if that's okay, Commissioner Rolfe.
Pardon me?
I put my hand up because I just wanted to jump in after Ryan was done. So.
All right.
Okay. Thank you, Ryan. That was very good. I think Catherine, who was the author of this grant, have done tremendous work, and all of the folks in our outreach services did talk and work on this grant together. I think you see we have a pretty diverse team that is able to meet all different parts of our community for this need. But I think what I wanted to reiterate what Catherine said was too, is that Good Samaritan, our services, would definitely be able to back up when a person comes out of treatment, where do they go? Because if they're returned back into homelessness, that's not a good place to start. Sometimes addictions start up again. So we've been very successful in helping people to get to houses for aftercare of treatment. And we've got job placements if someone wants something here at the thrift store. We've also been able to do all that because of the relationships our staff make with those that are on the streets at this point. So I just wanted to add that it'd be a full collaboration with this grant, with Good Samaritan Services and others in the community.
Does anybody have a question for the folks from Good Samaritan?
I have a lot.
I do.
All right.
Do you want to go first?
You're next.
All right, I have some too, and hopefully maybe we have some of the same to save everybody some time and heartache. This is Wes Feist, and a couple of questions that I have are typically the grants that we have recommended for funding. We've only approved a year, just knowing that we don't know what applications may come in the future, and to not fund multi-year programs, but with the hope of doing so, but not with the guarantee of doing so. And so by funding them for a year, and correct me if I'm wrong, but that was kind of the stand we took. If this was funded for 1 year for Good Samaritan, the way I'm understanding it is the position would be employed through Good Samaritan. What would that look like for you all? And do you have the ability to do that for 1 year, or is it a all or nothing?
So I'll step on first with that. Thank you for the question, Mr. Price. We all know it takes longer than 1 year to make change within the community and people's lives, because treatment may be 3, 4, 5 months or longer, depending on the situation and the treatment program. So when they come back, then they start rebuilding their linkage in the community and their supports to get things set up. We find that we work with some people many years ongoing. Maybe it's very intense to begin with, and then we continue to work with them on their needs and at the place they're at in that time. So I always feel it's best to have something in place like this program and its goals and objectives to continue on to meet the needs of people in the community, instead of you say, oh, our grant's gone. We always work for fundraising on the side. We've done fundraising for Ryan and his street outreach program in addition to the grants, so he gets the needs he has for the people in the community to make sure they're safe. We have funds to send people to treatment once they're ready to link up with someone like a person on the streets. And like Ryan said, that's where the most success is, and we know this for street outreach and bringing people in and making those connections. Do you want to add anything?
No, I think, you know, we've got a well developed and stratified funding stream. I mean, when I initially saw the RFP, I did write it for the 3 years. Perhaps I misunderstood, you know, that the full volume or scope of the funding, but standalone for 1 year, as Teresa said, you know, we have the street outreach position is funded in one direction. The opioid harm reduction strategy and the additional marketing or education components are an additive kind of added pilot opportunity. And as Teresa said, we've got a fundraiser coming up in May that will actually benefit street outreach. So we do have other coffers that we can rely on if we were not awarded another year. It would, you know, it wouldn't impact us or cancel out the opportunity, although, you know, the better opportunity is to have the funding that we did request, you know, if we don't, in all honesty. But as Teresa said, we've got enough, well, at least we've got enough, you know, to add that for the moment. Could it sustain itself after? I think that's what Teresa was addressing.
And all of the grants that we have seen have been written this way, so you didn't misunderstand it, because it's how usually it's kind of how it's presented to folks.
Yeah.
But we have been awarding 1 year, and that's also because the funding we receive for this decreases annually. So we don't want to guarantee 3 years of programs that we then don't have the same amount in the subsequent years. So no, you answered the question as to whether or not if one was awarded, that you would still go on and do this and try and achieve those goals. We can't guarantee a second or third year.
Right. We do understand that. I just think, you know, I can use an example with Department of Behavioral Health. We have their grant and it's continued through years. Well, we go until 27 with them, but having that backup support from the team and the training and to have a community help guide this grant has been so effective and helpful. So we would like to, if it eventually could go on more, to have that also with you and this grant.
Another question I have is, can you describe to me more the admin funds and tell me what that, I'm confused. Are you requesting admin funds, or I think what I'm seeing and when I look at your budget is that the admin funds you're replacing the position with your own funds over time? Or can you describe to me the 1250, 15,000 and 45,000?
So the admin funds we use as, I guess you would say, ancillary funding. For example, we have our financial person who is very, very good. She takes a piece of that to keep the numbers and the, if you will, the payments coming from this grant.
The contract management.
The contract management, I'm sorry, I got that. Yeah, thank you. So that's the contract management she does, and to follow the numbers and to follow the monies with that to see how it's working out, and make sure the financial reports get to you all. So that is what we're looking at with those admin, and most grants do have that in. Well, most big ones do have
direct or indirect grants. It's a formula that Bree, our finance manager, has utilized.
I misspoke in how I was reading it, but so you're requesting 15,000 annually for admin funds, correct?
No. Yeah. Oh, okay, there you go. Yes. I picked the wrong column, sorry.
Typically, admin funds are only 15%, and which is what you're asking for. So I misspoke on that. So that was I misread it until I said it out loud. And
okay. No problem.
You mentioned reaching out and working with rural communities throughout the county. What have you done throughout rural communities in the county, and what do you plan to do? Can you elaborate more on that? And what do you define as rural?
So I
Everything.
really actually think I will defer to Ryan on that and going into the different areas within Lewis and Clark County that are designated as rural, certainly not this particular capital area. But Ryan, if you could perhaps discuss what this would mean if we got this funding to go into more rural areas, perhaps, you know, heading up towards Clancy or any of the other areas that you've outside of the capital area.
Certainly. I think that getting this funding would really help us with expanding the area that we're able to serve. So right now there are encampments that are being created kind of outside of town. So like one that I've just recently discovered was kind of out off of Bird's Eye in Lincoln, which is about a half an hour away from here. There's a new camp that has been created on someone's private property, and it's really challenging just with the way that the position is currently funded, um, mileage reimbursement, and just looking at the area that I'm able to serve. um, Having this additional funding would allow us to go out further and try to engage other clients that I think we could all agree that, the further removed you are from the downtown area, the more challenging it is to get services. Transportation doesn't go that far, providers aren't going out there. And so it's really trying to not only locate these individuals and engage with them and build trust, but then how do we transport them into town for services? And that's where this could really be advantageous. And I also think that, one person doing outreach for the entire Lewis and Clark area is just not feasible. And so having an additional one or two teammates would really increase our capacity. So that way, as referrals are coming in to go and look into these rural areas and find new people, and connect them with services, we can go out and find these people as soon as they're coming in, instead of people falling through the cracks. That's really what we don't want to see happen. And what defines a rural community, it could really be different depending on who you ask. But I think for us, it's really any like up Beartooth Gulch. There's a camp up there. I would consider that, to even though they're relatively close, they're still far enough removed that I would consider that to be a rural camp up there. Because when people don't have cars and transportation, really, even just 15 or 20 minutes away from the service provider is really quite far away. I hope that helped to answer your question, and I would be happy to continue to speak to that if you have any clarifying questions.
I guess my objective with that question is that we would see an outreach to Augusta and Lincoln and Craig, but staying within Lewis and Clark County for the purposes of this grant. Hopefully in future years, the region that services Jefferson, Broadwater counties will have some assistance themselves, but focused on Lewis and Clark County being the areas north and to the east of us, or excuse me, north and to the west of us, more that are underserved as it is. So that was kind of what I was looking for, and would be the hope of this, what that rural means, sticking within Lewis and Clark County.
So if I could add to that too, and when I hear rural areas and this may be because I worked in New Mexico and worked with the Native Alamo Reservation out there as well. But there are many ways we can begin to reach out more. We serve many people who are Native American that come to Good Samaritans. We've become known on a couple of the reservations too, that where they call us to find people now. So I think that goes right back to the 1 year, 2 year, 3 year. That takes time to build that trust in those areas like that, especially if we're going in as an unknown. So there are ways we can build that over time, but also I think the way to do that, and this is something that I truly believe in and have done, as I said, by living in New Mexico and working with the Alamo Reservation, but you build that trust. And I think one of the first things we can start in building that trust would be some online groups to bring people in and to make that connection. It's very, very important that we go in that direction because there's so much drug use on some of these reservations. So I hope that gives you a little more information on when I think of rural areas going out like that. In Augusta, yes. So I hope that gave you more information.
And if it was awarded, rural would only be within our county because the grant is kind of specific to who we're serving. But thank you.
Yes, absolutely correct.
The other question I have, and we have proposed and discussed with all of the applicants, is there are a lot of goals in here, and I think that your goals you have a lot more quantitative and qualitative information in your goals than some of the other applications that we've had to get more information from. However, you have some items like just increasing the number of and increasing opportunities, but what I think what we would like to see, at least I would prefer, and I would recommend that we see in the future for future conversation, is more information as to if you're seeing a number from what to what, not just to increase, but is that from 10 to 20? Is that, I mean, and there are various examples within the evaluation method and the data source information that you provided, but what does that actually mean? So that there are measurable items for a year 2, year 3 potential grant opportunity to say, okay, you did increase it, but not from 12 to 13, but from 12 to 20. What I just to see, not that we hold everything to that or would, but I think that needing to see more information of where you start and where you're going would be helpful.
Sure. I mean, we would start definitely with the data that we obtain and utilize through HMIS, the Homeless Management Information System, which Good Samaritan Ministries is very active with. And Ryan, since coming on board last summer, has jumped in and ensured that we are capturing information. He was actually one of the individuals recently that oversaw the PIT, the point in time survey at our place. And so the data will come from who we're seeing now, right, as kind of like our base, to where, as I put into my logic model, to where we will be with this additional funding stream or streams and additional staffing. As Ryan said, can't be in several different places at one time, although on a daily basis, he's getting information about, you know, people over here and individuals over here, displaced individuals here, new arrivals, if you will, to the area, you know, presenting with substance abuse, mental health, and co-occurring disorders in this area. So we'll start with the base of who we're assisting now and how we're able to assist, or how we're not able to assist as much as or comprehensively as we would like, and use that as our base for our incremental you know, qualitative and quantitative counts. You know, quantitatively, who are we assisting? How many individuals? Qualitatively, what are we able to build in? What are we able to add now with the additional peer support, outreach professionals, and you know, assistance with our with getting to the different points and locations where individuals are that we meet them. So that is a good point. And I was not deliberately vague, but certainly the numbers, we can give you measurable numbers now. We have them in homeless management information. Ryan knows what his caseload is currently, overwhelmingly, and what it may jump to or could jump to should we have the resources to allow that.
Thank you very much. Those are all the questions I have.
Just an add to there, I know that you provide to the county some specific numbers as on a monthly basis, and that might be a place to where you can pick some of those up.
Yes, sir.
Yeah.
So I just want to add to, and I say this fun, but it's very, very true. We are the masters of data, what we've got. And we've improved that over the years with each grant we've had, what different grants may want. So we keep those to better our database all around, but we have lots of data, and many times grantors will come back and say they want additional. We'll definitely just put that in and start keeping that data as well. We could probably tell you how many Native Americans have come to our place, or how many have been in treatment before, or how many are actively using, because folks that come to Good Sam's are very upfront and honest with us. So we've got lots of data.
And the data, again, what I think I'm looking for is the data on where you are and what you're hoping to get to, knowing knowing what some actual metrics are of those that are being served in our communities.
Yes.
Yep. I didn't extrapolate when I spoke with Ryan about this grant and our intent to apply the numbers that were currently of individuals utilizing opioids, and because we didn't necessarily have the specific funding to have those numbers. It was a dialogue, it was a discussion, it was a knowledge that individuals that we're meeting, in the streets and on their terms do have substance abuse, mental health, and co-occurring disorders. But to extrapolate that specific number was not our area of expertise, if you will, or what we were, working on at the time. And so and there's a number of shared clients that we have with other organizations that we've given warm handoffs to. So, point being that now, if we were successful with this, right off the bat, the first paper or the first action item we would publish would be, these are the people that Ryan has identified with the conditions and the issues that we have not yet really been able to address, and now we can address them.
Thank you all.
Thank you.
Colleen Smith, Youth Connections, also certified prevention specialist. So all my questions are going to be geared towards youth and prevention. What are you doing right now working with youth?
At this point, we are not working with youth. This grant, as you heard Catherine say, she'd like to move more into that direction through this. We've mainly worked with adults, because we would refer people under 21 to the youth homes or those groups that address that age group. I think, like Catherine said, talking about prevention, it would be good to get into the schools and classes and talk about what we see and how to prevent these things. So that'd be part of it as well. And that's a first for us to do that.
That's a big job.
Sure, yeah,
it is.
I understood. It's actually an area of expertise of mine when I worked in the Tampa Bay, Florida area on prevention programs and strategies. And so I am a retired educator. I worked with the Department of Juvenile Justice in the Tampa Bay, Florida area on harm reduction programs for everything from smoking, alcohol, to just behaviors that would endanger individuals and prevention. And so I, up until 6 months ago, was a substitute in the Silverville County School District. So I don't have any history here in Lewis and Clark, but the intention was, I'm also a writer, a screenwriter, and a playwright. And so there's a lot of evidence-based tools in the schools to kind of approach the very sensitive topics of drug abuse and addiction and for harm prevention, to start the dialogue. And so we would follow one of those protocols. I believe I put them in my some examples that we could potentially use in my kind of notes at the back of like the references, the additional information. So I do recognize that it would be a pilot program, ma'am, that we, you know, as Teresa said, we've not been in the schools, we've not had a large imprint with youth. But I am a strong believer, again, having been an educator for over 20 years, that oftentimes the prevention, if it starts or the dialogue starts when they're younger, perhaps will prevent or abate some of the issues that individuals are having when they're older.
So you have not worked with the Helena School District, and you guys don't know what's already being implemented there, or the East Helena School District, or?
No, we have not worked in the schools yet. That typically for street outreach, we don't come across many youth. Those that we have, they've been 18 to 21 in that younger age group, and they usually come down from our shelter or another place within town. But as far as the school knows, I'm not completely sure what's going on. I know they do have some, but we would like to enhance what they have as from being on the streets and from peer supports, eyes and ears of how they have gotten through all of it, through the addictions and so.
You know, and even if it wasn't in the schools, we have enough partners at the community nonprofit level that do work with youth, that this could also be, you know, a program there. As I mentioned, it's something that is a first foray for us, Good Samaritan Ministries, and you know, it's not a significant budget item of our grant, and it's not a deal killer if it's something that is not permissible. I honestly thought that it would enhance, because our assistance ministry and our assistance ministry coordinator works with families, and so many of the families that come in that do have children, you know, have indicated that they're not getting the services wherever they are. And so it made my brain go in a direction of perhaps we need to have a pilot program, and this is the opportunity. I'm not trying to usurp any current programs, but we are not, you know, we would certainly work along any and all programs that were there that thought that Good Samaritan Ministry in our approach could be useful.
Yeah, I think we just want to make sure that we're not duplicating efforts.
No,
Number
yeah.
one. And
absolutely.
yeah, I mean,
That's
like,
never my intention.
Yeah, I mean, if you're trying to implement an evidence-based program in the school, like you really need an MOU and
Yeah,
I get this pilot program.
So it's more of us coming in there from the Good Samaritan Ministries, this outreach approach of presenting, and I've seen enough in the school districts and many areas where we're coming in there not to be formalized in that school or in that school district, but to augment or to be part of the dialogue that they're currently having. So.
Another quick question. Are you guys on the Connect system? Are you using Connect for your referrals?
We are on the Connect system. We mostly work with the case conferencing committee, and where we do connect with people, other agencies and stuff, but we do have Connect. We have our logins for that, yes. I just don't think it's used as much. And what I've gotten from staff at the same time, it's just easier to give that agency a call with a warm handover with someone instead of sending it through Connect. But we understand Connect and how it needs to be used.
Other questions? Mayor Collins, do you have questions for the folks?
I had, but they were answered.
Okay. All right. Any others? We really appreciate your taking the time to come in and share your vision. And we're going to take some time and talk about it here a little bit and see where we go from there. All right.
Thank you for your time and dedication and what you do. Appreciate it. Thank you.
All right. Anything else you'd like to add before we sign off with that?
No, we just appreciate this opportunity here to help expand our services on the streets, which we call outreach services, and it's a lot out there, and it's not getting easier. There's not less people. It's growing, so
All right.
thank you.
Thank you.
Thank you,
Thank
everyone.
you.
Have a good
You too. Bye-bye.
Any thoughts that Mayor Collins or any of you want to offer?
As written, I'm gonna say no, but if they wanna like tweak it, like take out the entire youth piece, they've never done it before, they're trying to do a pilot program. The stuff they're listing is not evidence-based, like take that money and put it somewhere else, but don't go into something that you have no experience in or are hoping that would beef up your application by trying to hit so many different things.
Well, and that's where they have so many other pieces.
Yeah.
Plus they mentioned the rural, which is where
Yep.
I thought, how do you plan to do rural, continue what you're doing, youth
Mhm.
that you haven't done?
Yeah.
Like, that's a lot for one role.
Yeah.
No, but guys, Montana is a rural state. Helena is rural. Everywhere in Montana is rural. So, like the guy said, you got to look at what you consider rural. You were very specific. You were looking at going out to Augusta and other places, and you know, yes, I agree. It's a new program for them, but we can't rely on the fact that we're saying it's rural. That word, because according to the federal government, we're frontier. We're not even rural. We're frontier, so we're below rural. So,
According to this grant, the Lewis and Clark metro region includes Helena with rural
yes,
surrounding communities. And if they're going to mention rural, I wanted to know what that means, because that does not mean the city of Helena. Rural in that context means the rest of the county, which is what needs to be served as well. And Good Samaritan currently only serves the city and very close proximity to Helena. He even
Yeah.
mentioned 20 miles. So that would be my goal with them, is to define what that outreach is in rural areas of the county, not including Clancy, not even in our
It's not
county.
even our county.
Beartooth Gulch, which I thought was in Broadwater County. Maybe I'm wrong with that. I thought that was not. Anyway,
Up
but
near north of Holter Lake.
oh, it's north of Holter. Okay, so but anyway, I just want to know what that means also. So to be a little bit more honed in on all of it,
Mhm.
and maybe pick something, not try and be it all for everyone.
I hear you. I hear you. And in my own weak way, I'll say I think it's a good program, and I would love to support it.
I think the peer outreach and that is great.
And the work that they do currently is good.
Absolutely, 110%. But and they talked about people that leave the hospital, which now we've funded that. They're talking about corrections, which now we've funded that. So I'm wondering how all these work together. Again, not duplicating efforts. If they just want to go out and do homeless, that's great, because that's a population that definitely needs additional assistance. But yeah, I guess I would need some additional information on, and they don't know what those grants, because those are brand new too. So yeah, I just want to make sure we're not duplicating efforts.
The other kind of concern is, and I know Teresa fairly well, and she's pretty adamant about things, which is good. But the thought of not having a 3-year guaranteed grant was almost like, I don't want it at all. That I just kept trying to get that, not that, and that's all I seem to feel. So I have a concern that if it was a 1 year, would the objectives be worked on, or would they just do other things to get, I don't know, not that they would misuse the money, but to put it toward other areas to, because it didn't seem to be of interest if it was just a 1-year grant, but that's what we've been doing. And I know that unfortunately the grant portal makes it seem like you need to apply for 3 years. So
I think what
Well,
Colleen says makes sense. We can always, send back our concerns. Hey, would you answer these questions that these concerns we have? As
And the admin part, having, grant management, I'm in the middle of that right now. They get all the money up front, and there's no like monthly reporting or anything. It's just, here's your money. And we would, maybe ask for a report at the end of the year. So I don't see where all that admin's coming from or would need to come from.
We do.
I did read that wrong. I looked at it on my phone and it was showed differently, and then when I saw it printed it anyway, so that was my mistake of how I was reading it.
We do. We give them about $100,000 a year for working our place operation and its new location, and they give us a report every month with numbers on it. So I think they could probably provide numbers if you wanted them, but that's part of our deal, is we want to make sure we're seeing the kind of activity that's needed.
But if we're not asking that of every grantee, then I don't think we can just ask it of one. But if we could take the 21,000 or whatever it was that they wanted to do with youth prevention and whatever, and some of the admin, and move it into more peer support and outreach, I would rather do that.
All right. So what is your pleasure? Do you want to chew on it a little while first, or do you want to give them some feedback on it?
I would like to request more clarity and a focus of their vision.
Okay.
And maybe ask them to take out the whole youth prevention piece.
And
It's too much.
And maybe share with them the funded applications to not duplicate service. So with the 3 that we have.
All right.
They're listed on the website for the state. I'm gonna check right now if they can actually access those applications. Looks like not, they're just listed. So we can get those.
Okay. Just so they can see, we don't want to duplicate that.
Right. And could they tweak their application a little bit so it dovetails with it better?
And that if awarded, it would be a year award with the welcoming of the continuation. That we will reevaluate after a year, but not a guarantee of 3.
Did we start with 600,000 this year?
Yes.
And so next year's only 400,000. So
And
yeah,
following
we've already
year's
got
more
less,
as well,
200
right?
less.
And I don't think we know for sure what it's going to be, but that's the estimate, isn't that right?
Yes. It's a conservative estimate is what the most told us.
Here's what they told us. This is where we were. This is what we're told is the 400,000. They're estimating 2 years after that, and it's based on fiscal years. July through June.
And I would like to see, you bring up a good point though, the applications that we have funded and we had one for youth, but it was challenging to get information. I wish we had a youth focused program that was worthy of approval. Cause now we've kind of hit a lot of other spectrums.
Yeah,
So does that give us enough direction as to where we wanna go?
We made enough money for you.
Yeah, Carol, yeah, let me just.
Yeah, sure.
Feel free to jump in. And so we'll be providing feedback to Good Sam, requesting some additional clarity, a tweak and a resubmittal of their application. They'll be asked to remove the youth component, provide additional evaluation specific information, baseline data, and where they hope to go from there. And then potentially some information related to the sustainability of the program beyond the 1 year. Should there be 1 year? Make any adjustments that they might need to within that vein.
And the only other clarity piece I would request is if they want to have a rural focus, as they mentioned, reaching out to rural communities, what does that mean?
Sure.
You know, and this might be an opportunity for us too, to take a look at that Region 4, some of that Region 4 money, maybe fund part of it through us and part of it through, see if we can fund part of it through Region 4, because they specifically were talking about trying to get into the Clancy area, and maybe they would make a difference that way
yeah,
too. I
depending
mean,
on how far out they want to go.
Mhm.
And how far out that region actually is.
Mhm.
Yeah. So, all right. Are we all pretty well settled on that? Okay,
Oh, sorry, one additional
Go ahead.
clarifying question. Did you want them to remove the indirect funds, the admin funds, and then
Maybe
just the
just-
budget?
Maybe just tell them that all the money's up front and we're only gonna ask for like a report, not even a big report, but a small report at the end of the year, so that it shouldn't take $15,000.
It would be a 6-month report and a final report. For you.
But even that,
okay,
Yes.
Yeah. Yeah,
all right.
and maybe under the bow of we're interested in it, and we
Yeah,
think they could serve a good purpose, but
right.
we just want to help make sure that it serves the county as well as it can.
Okay. All right. Have we heard anything back from the school district about the proposal? They haven't read anything with it.
Mr. Chair, the last that we left it with the school district was that we did provide them a formal refusal of that particular application. We opened it up, of course, that they could reapply if they wanted to, but as of now, not aware that they have reapplied.
And I called and left a message to that effect with a couple of contacts as well. So, all right.
I also had a conversation with the nurse at Capitol High. They're doing some of the stuff that's in that application. So I'm like, have you talked to Lana Scanlon? So, and the other thing is the state money that we were asking what they're gonna do, they're gonna keep it and do their own project. So there won't be any duplication of efforts.
All right. Anything more on funding? Then if not, let's move back to election indication that James
I haven't heard.
sound.
He must still be under the needle.
All right,
So
So I got a question, pardon me,
sure.
Mr. Chair. I don't know, I haven't looked at our bylaws to see what this does. Would it make more sense for us to be on the same fiscal year? Instead of over like July 1 to June 30? Or, you know what I'm saying? For officers?
For worth some consideration. Now, in the case of the county, as far as having somebody here, we generally change it every year because our our chairperson is January through December, even though our fiscal year is July through June.
Okay, so that won't really change anything as far as January through December.
Mr. Chair, if I might. Yeah. I do have our bylaws in front of me right now, and it does specify the calendar year annually. That
Okay,
we would review annually at the beginning of the calendar year. So it would just
Okay.
require, not to say that the conversation can't continue, it would just be an amendment to the bylaws.
Okay.
and it says that the first regular meeting of the calendar year is when we're supposed to elect on.
Gotcha, okay. I
Alright.
didn't.
I do
My bad.
now remember that.
Now.
Wow, have we
But I
really been meeting for a year?
Yeah,
All right. Okay. Any other thoughts? Let's talk, do you want to, should we move ahead with the election then and appoint someone to be?
Yeah,
in-
James isn't here. I think we should appoint him.
Pardon me? Pardon me?
I said James isn't here. I think we should appoint him.
You know-
That's probably not fair.
I tried.
Hmm.
Well, I guess formally we should have a motion, if you agree with my thought about moving vice chair up to the chair position, we should have a motion to that effect.
Yes, I think that's what we agreed on, that,
Mayor
I wasn't ready
Collins,
to take it, but
we can't hear you, sir.
I'm with
There.
you on that.
Okay. All right. We'll see a motion from Colleen, a second from Mayor Collins, that Wes would be the chair for the next year, calendar year. All those in favor say aye.
I,
All right, motion passes 4-0. Now, we have a nomination for vice chair.
Do we nominate in absentia?
Yeah. I was gonna say, well, you're the one here. He's out. It's
Yeah.
either
right, I don't care. I mean, I'm happy to do it.
Okay,
Next year will work out better for me. I'll be retired. So.
oh,
wow. Would we have a motion?
I move to appoint Colleen Smith as vice chair.
All right.
Second.
Oh, I thought you were raising your hand, Mayor, like you wanted the position.
No, I'm second that motion. Are we stuck? Uh-oh.
Yeah,
There you are.
there we go. All right, are there any other nominations? There being none, all those in favor of Colleen being the vice chair, say aye.
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 Motion passes. All right.
And I think we should tell James that he has been nominated for both.
Dentist
All
is
right.
not the right excuse.
All right. All right, is there anything else that we need to talk about? Anything that staff feels that we should bring up?
Commissioner Roth, I did just want to get some clarification as to the timeline for which you'd like to have responses back and a subsequent meeting if you'd like, or do you want to have them submit for the next quarter, just so that we're
When is the next MOAT meeting?
April 10th.
10th of March,
April 10th.
April 10th.
Yes.
Oh, okay.
So
So that was for something or other that we needed to have something in by the 24th of February, is that right?
That was, sorry, Chairman, that was to respond to the advisory committee nominations.
Oh, okay, all right.
So I think they were hoping to get that response so that they can then do that at that subsequent April meeting.
So we've generally tried to meet sometime within the month before the statewide MOAT meeting. Is that right? So do you all have
I would love it if we could do it.
So
Well,
if
quite a
we
dance
need to
last
get,
time, wasn't it?
how soon in advance do they need recommendations for funding? Is it 2 weeks prior, 10 days prior?
I believe the preferred is a full 2 weeks.
Okay, so that would be the 27th of March is when they would need the recommendation. So if we were to recommend this, so working backward from there, if we were to meet the week of the 17th of March,
Okay.
and then we could give them until somewhere in between to reply to us. Is that, am I on in a remote meeting, maybe?
Mhm. Well, the legislature is in Transmeadow starting the 8th, so anytime that next week is probably the best.
We get the 12th,
So,
10th.
would potentially the 12th work for everybody?
Meeting, but it's been canceled. So I don't know if it's a quarterly meeting, but it hasn't been held for at least the 1 o'clock hour. I could do 10, 11, or 12.
Wide open that day.
Does the 12th look good to you, Mayor?
Yeah, sure.
All
Will
right,
that give them enough time
Couple
If-
weeks.
if they were to get that to us by the 5th of March? That gives them 2 weeks from today. Not knowing the two of you, your schedule, how quickly are you able to get them all of that information?
We can get it done tomorrow.
Okay,
okay,
don't want to put too much on you.
Yeah,
you
that's good timing.
So then they would have until the 5th, and that gives us a week to, or maybe the 6th to give them a full 2 weeks.
Mhm.
Is that fair?
Yep.
Mhm.
Okay,
so you're thinking,
so they would have, Good Samaritan would have until March 6th to get us information. Ann and Amanda will get it out to them by tomorrow. They have 2 weeks, and then we have just under a week to review it before the 12th. If that's fair.
That's plenty of time.
all
And
right,
then we would meet and then have time to get the most information if we recommend funding.
May I ask just on the 12th, what time the group was thinking?
what time of the day?
I'm available all day because of Transmittal. I'm horrific.
I will say that both of the meeting rooms, this meeting room and 326, are booked in the afternoon.
Could we do a virtual one since we're just kind of reviewing?
Is that agreeable? Okay,
So
Yeah.
normal time, 1:30.
Can we do 12 or 2 or 10 or 11? Oh, I have a meeting at 1, but again, I don't.
so 2 o'clock.
2 would work.
Would 2 would work for me,
Great.
okay,
I'm fine with that.
Clock, okay.
okay,
All right, I'm gonna hold you all to it. Block your calendars.
all right, sounds good. We'll get a hold of James, let him know, and just make sure it works for him as well. Good,
And then I will officially be chairing the next meeting. Is that
That's right.
correct?
all right, I'll hand you the gavel.
Yeah. Mr. Chair,
Great.
Mr. Chair, I will not be available on Wednesday, March 12th, but I don't see any reason for that not to proceed.
Okay.
so.
All right,
I have one other comment to make. Since we have awarded 3 applications, have you reached out to media? Has anybody reached out to share the news of?
I actually think that Jovan Wagner from Montana Free Press is on the call.
Oh, she is. Perfect timing, Jovan. Just to I think fact that there has been a lot awarded throughout the community, and the state seems to be lagging behind us.
Yeah.
In general, that it's just a great opportunity to share that there's been some work, and now that we have one completely funded, and well, 2.5 completely funded, that's great. So
Well, isn't that part of their application is how you're going to share the information? Share that you got this or what you're doing? Maybe not the award, but what they're doing. Maybe it should come from that.
yeah, and I don't know where that should come from, but
Right.
yeah, and I know that oxygen is consumed at 1301 6th Avenue, but this is some good news in the midst of everything. So
Good.
Colleen, do you have a new email?
Yes, it will automatically forward,
Okay.
but I do.
All right.
All right. Is there anything else we need to cover?
May I do have one comment? The city of Helena, East Helena, and Lewis and Clark County will be doing our annual community needs assessment meeting on this coming Tuesday, February 25th. Is there interest by this committee for us to have a slide or two regarding these opioid funds that are available through the state? We have many nonprofits that you've already seen that attend that meeting that I think would be eligible applicants and have eligible projects.
and that we have a missing component of youth, I think is, I think that's an important mention maybe, but that, yeah, and then the funding that has happened. Yeah.
Okay.
We'll make sure. to include
You'll take care of that for us?
Yes, we've drafted the slide. We just wanted to. We're good, but we will add that.
And I think the new chairman can, if you're available.
What day is it?
It's Tuesday, this coming Tuesday, 6 p.m. and 326.
Is Mayor Harris coming?
I'm not aware. We have been in touch with Amy Thorngren. And
Oh,
she's
okay.
aware.
Okay.
I'm not sure who she has notified.
Gotcha. And sorry, what day? This is the 25th.
Yes.
Okay.
And if you're not available, Ann and I will be there. So
Yes.
we are out.
Sure. No, it's something that we typically
lot on
like
your
to
plate.
attend. What time is it? Where is it?
6 p.m. downstairs, 326. And we also have a Zoom. I will get you all those.
I gotta
details.
run, guys.
Okay.
Thank you, Mayor.
Thank you, Mayor.
Yeah.
Yes, while that meeting isn't intentionally or not specifically for all grant programs, it's specific for like the community development block grant that's requirement for, but we do bring up other grants that could be optional. This kind of work, so seems like a good opportunity.
Yeah, to
Mhm.
get out there that
Definitely.
it's available, and
Good.
then we'll get like 45 grand.
Yes, I was a little concerned about that, but you've already seen at least 3
Mhm.
that would probably be potential.
No, I think that's good. Get the word out a little bit. Thank you. Well, and I really, these two have just,
yeah.
they've done a great job of taking
Very
care of
much so.
things for us. And I really appreciate the good effort. So
Absolutely.
I know that they'll do the same for you.
They have them too, yes.
All right. Well, I'm supposed to ask if there's any public comment on any matter that is under the jurisdiction of the opioid committee for Lewis and Clark County. Is there any public comment? There being none, we're adjourned. All right.